Go ahead and get started. Again, welcome to the Quality Connection. Today we have the fabulous Heather Cook coming over to review Into the Mouth of Babes. I have requested, your name, your credentials, job position, email address to be dropped in the chat. However, Heather mentioned there will be a QR code that I can send out after today's presentation as well, so that you can receive your credit hours after the presentation today. As a reminder, we do ask that you all do not record these sessions. We do record them, and right now we are including those recordings in our monthly newsletter, provider newsletter. However, I do believe with a little bit of magic, we will be able to start sharing these weekly recordings out and weekly. So that'll be great. But on that note, all righty, Heather. Are you ready to start sharing? Because I am good to go on my end.
Yes, I'm good to share. Let me see if I can go ahead and do that.
Uh-oh, you breaking up on us.
Oh, can you hear me?
I can hear you. It's a little sketchy. But it
Oh
might be me. I'm gonna
no.
turn my camera off. No, it might be me. So let me just kind of reduce the bandwidth on my end. Keep going.
Okay. If you can't, just let me know. I'm usually at home when I do these, but I'm actually in an office today, so I'm hooked up to their um internet, and I'm hoping it's gonna work
I think it
okay.
may just be
Okay.
Crystal. You sound pretty clear to me.
Say it
Okay,
again,
good.
Mark. You good?
Yeah.
Thank you.
So where I'm sharing my screen, I can't necessarily see the chat box. But if anybody has like a pressing question, please by all means feel free to unmute yourself and ask. I'm also happy to, try to answer anything at the end. I also have a lot of resources that I usually send to Crystal. I don't know that any of it is updated since last year when I did this. Like if anything has like greatly changed. But either way, I'll send you that, and you're welcome to send that out to everyone. We'll go ahead and get started. So I'm Heather Cook. You may have heard this presentation before, but it's a good update for offices. And it's just for the Into the Mouths of the Babes program. So disclosure, North Carolina Oral Health Section ensures the content quality and scientific integrity of this continuing education activity, and we don't have any financial relationships to disclose. So the objectives of the training are to just describe evidence supporting fluoride varnish and the Into the Mouths of Babes program, conduct an oral evaluation and a risk assessment for infants and toddlers, identifying risk factors for early childhood caries, how to refer children to a dental home using risk-based guidelines. We'll talk a little bit about applying the fluoride varnish, provide caregivers with age-appropriate oral hygiene instructions, and then we'll go into a little bit about filing the Medicaid claim. Computer's frozen. Okay. So your baby teeth or your primary teeth, they do have important jobs. They help you eat, speak. They hold space for permanent teeth. So when children lose those baby teeth earlier than they should due to, decay, or maybe they've hit a tooth, that can cause some spacing issues when their permanent teeth start to come in. It also helps with your self-esteem. Um, Obviously your smile, and then also it contributes to your overall health. So your mouth is just kind of, like the opening to the rest of your body. A serious problem in early childhood is decay, and you can see by this picture, this child has a lot of decay in their mouth. So did you know that caries or cavities are the most common chronic disease among children? About 42% of North Carolina's children enter kindergarten with some type of um, treatment that they've already had done. So whether that's a crown, they've had a tooth extracted, or they just had a fill-in. And then about 19% of those children have active decay in their mouth. African American and Hispanic children are more likely to experience decay. And then caries or decay in primary teeth predicts caries in permanent teeth. It makes sense if you think about it, because, if they're not taught that it's important from a young age, then they're going to kind of continue that on throughout their life. So the recommendation for the first dental visit, the ideal situation would be that every child would have a dental home by 1 year of age. Depending on where you're located in the state, that's really unrealistic. Not all our counties even have a dentist. Some of them, a lot of the counties have the dentist, but maybe they don't see young children. I don't know anywhere that I called around for some of my counties when I was trying to get a list of places to refer children that I see in schools. None of them said, yeah, bring your 1-year-old in. They were all like 3 to 5. Um, so that's the ideal situation, but the reality is that 80% of children ages 1 to 5 had not seen a dentist by their first birthday. 96% of children under the age of 4 have, however, visited their physician, their primary care doctor, their pediatrician. So a dental home is considered a comprehensive, continuously accessible, family-centered, coordinated, compassionate, and culturally effective care for children that is modeled by the American Academy of Pediatrics. So that could be a dental office, like a FQHC, which would be, maybe like a health department, anywhere that has a dental clinic. A dental home would not be considered like the buses that go into schools or anything, because they're just going to see them and then they're going to be done. So it'd be like a brick and mortar building. The good news is that caries are preventable. Fluoride does it best by toothpaste in the right amount. Community water fluoridation, which most counties have. So if you're hooked up to county or city water, you have an optimal amount of fluoride. I don't know. I'm so sorry. I don't know why my computer keeps skipping ahead, but you'll have an optimal amount of fluoride that's added into your water system, and it's supposed to be regulated and checked. You can Google it. There's a website called My Community Fluoride or My Waters Fluoride. If you just go into Google and type in, My Waters Fluoride, it'll pull up a website that has it has the whole United States. You can click on North Carolina, and then you can click on where you live, and it'll tell you what water system you have. If you have county or city water, the only downfall of that will be if you had well water. You would have to get that tested individually, usually through the health department, but the cost of that varies. And then fluoride varnish that's applied regularly by a health professional. So when it is used correctly, fluoride should be safe and effective. So there's different recommended amounts. So the commercial, they give you the huge smear of toothpaste. That's not actually what you need. So from the time a child gets their first tooth until they're about 3 years old, you really only need like a smear of toothpaste. And you can see what that is on this picture. Is just exactly what it says, a little bitty smear about the size of a grain of rice. For this says 3 to 6, but it's really like 3 to adults. You only need a pea-sized amount of toothpaste to get the job done. So how fluoride works, I explain it to kids. It's like vitamins for your teeth. Helps kind of rebuild your tooth structure. It's found in toothpaste, like I said, some tap water, and then the fluoride varnish that's applied either at a pediatrician's office or when you're going to a dentist office to have your teeth cleaned. A lot of times they'll place it on children's teeth. But like I said, it's like vitamins. It helps rebuild that tooth structure back up. And sometimes it can even reverse like early signs of tooth decay that have started forming. It's recommended from the time they get their first tooth by the American Academy of Pediatrics, the ADA, the AAPD, and the AAFP. This is one of the websites. This is ilikemyteeth.org. I want to say it used to be My Community's Water Fluoride. But if you want, I can send a link to this as well. And this is just where you can go online and see what your water system for your house has. And research has shown that community water fluoridation reduces decay by at least 25%. And obviously that's going to benefit all age groups, not just children, whoever is drinking tap water in the home. So the topical fluoride varnish is safe and evidence-based for infants and toddlers. It can be done at well child visits and dental visits. Medicaid pays for it. Some private insurance companies will pay for it. That would be something that you would have to call each individual company, one by one, because even if they have the same insurance, may not have the same plan. And then there is a handout on topical fluoride at this link below. And so I'll send that link as well when I send Crystal all the little pamphlets and links for everything, and she can share that with everyone. The United States Preventative Service Task Force recommendations are that all children younger than 5 years should receive fluoride varnish treatments at their primary medical home. It's real sticky. It sticks to their teeth. There's really hardly any swallowed because it is so sticky, and it'll brush off whenever they brush their teeth again. The goals of the IMB program are to prevent and reduce early childhood caries, and then also just increase referrals to of high-risk children to dental homes. Because like I said, a lot of times these children are not seeing dentists already, but they are going to be seeing a primary care physician. So how the IMB program works, there's an oral evaluation, and then there's an education portion, and then the actual fluoride varnish application. So the eligibility, Medicaid beneficiaries from the time they get their first tooth until they're 3.5 years old. It can be done up to 6 visits before age 3.5. It can be done at a sick visit. It can be done at a well child visit. Anytime they're coming in, even for, just update vaccination visit, it can be done. It just can't be done more than 6 times in that range. So about, every 6 months. And it has to include the oral evaluation and the caregiver counseling, which is the code 0145, and then the application of the varnish, which is 1206. Excuse me. So for the oral evaluation, it's not a definitive diagnosis. It's not asking anyone to be a dentist. It's just a quick visual assessment. It has to be completed by a medical provider. Unless you're working in a public health department, then the nurse and staff can do that evaluation. It provides opportunity to complete a risk assessment. We'll talk about in a minute. That's not something required, but it is a good tool. And then it provides the opportunity to go ahead and refer them to a dental home. So PPE, a face mask, eye protection, gloves. CDC has the most up-to-date information for what you should be using for PPE, but that's just like a minimum that you want to use. Definitely the face mask and the gloves. So you're going to have gauze to dry the teeth. You want to have good lighting. You can use a disposable mouth mirror. You don't have to. And then a risk and referral tool. So the oral evaluation steps, this does not have to be an additional step in your exam that you're doing of the child, but different ways to do it are to have the child in a knee-to-knee position on an exam table. You just want to look for anything that doesn't look normal and then record those abnormal findings. So deviations from normal, this wouldn't be, immediate referral, but you can see in this picture, they have a lot of plaque around the gum line. It's okay to tell the parent, like, hey, when you start brushing this off, their gums may bleed a little bit. That's going to be normal. It's just like kind of removing that infection from around the gum. White spot lesions, this is not decay or caries. However, when you see this, you want to point that out because that's the first step of the tooth breaking down to becoming decay. So when you see that, you want to say, hey, this isn't a cavity yet, but this is a place that's real susceptible to becoming a cavity. So make sure that you know that you're really brushing that area well. Enamel defects, depending on, medication some children have been on, or just sometimes they're just born with their teeth are erupting with enamel defects. So that's something that you want to refer for. Obviously, there's not anything you can do to fix it at that point as far as changing the enamel, but sometimes they're going to be more susceptible to decay. You want to go ahead and make sure that you get them referred to a dentist. They may, can put crowns on the teeth. They can do fillings on the teeth. It's just going to be a more high-risk patient for early childhood caries. And then this is a cavity, as you can see. You want to refer for that. This is an abscess. Some people refer to it as a gum bowl, but it's an abscess. It's always going to be like where the root of the tooth is. Those are something that you want to go ahead and immediately refer for. They're going to need an antibiotic. Sometimes they have to do like a root canal basically on a baby tooth, or they have to have the tooth taken out. But if you don't refer for that, a lot of times they can go away and then they can come back. And then sometimes when they come back, they'll swell the child's face up really, really large. So you want to go ahead and make sure you're referring for that. A newer product in the last couple years is silver diamine fluoride. It's just, it's not a final fix, but it's really good for children who maybe have 1 or 2 areas that are real small that they're not going to want to sit through a dental procedure. It's not expensive. My child actually had a tooth that came in with an enamel defect, and we put this on his tooth until he was a little bit older and he was able to have it fixed. It does turn the tooth black. It's only going to turn it black, where the decay is, or the decalcification. There's low toxicity. There's no adverse effects that are reported. It's just something to be aware of because, you could say, hey, it looks like you have a cavity here. And if the parent says, well, we had this silver diamine fluoride put on it, then number one, that means they're going to see the dentist. And number two, okay, well, he has the decay, but it's been stopped. It basically stops the decay from becoming any worse where it's at. So it's a really good interim intervention. Any questions so far? And I can't see my chat window, so please unmute yourself if you do have any
Good,
questions.
Heather. So far, the chat's pretty quiet.
Okay, I'm going to continue on then. So parent and caregiver education. A lot of the stuff I'm going to send to Crystal. I'm not sure if you have any of the stuff last year. A lot of it's probably going to be the same, but it's really good handouts. There's some websites that you can give out to parents to look at things. But this is just they're really good educational resources. So you want to start building brushing habits when they're young, starting with that fluoridated toothpaste twice daily. I know fluoride is kind of a touchy subject nowadays, but we're still going to recommend it as far as evidence-based goes. You want to attempt to establish a dental home, not necessarily by age 1. Like I said, that's not the most realistic thing, but that's the ideal situation. Even if you have a mom who's going to the dentist, and she has a young child, even if maybe, they're not going to sit there through a dental visit, or you don't know that they'll cooperate, it's good if you can just take them with you to get your teeth cleaned. That way they can kind of get used to being in the environment, seeing that, hey, this isn't so scary. Now, obviously, you don't want to take them with you to get your tooth extracted or to have a root canal, but just for a routine cleaning, it's good to just get the child in the office. Obviously, avoiding a lot of sugar. You don't ever want to put an infant or a toddler to bed with a bottle or a sippy cup, especially with juice or milk in it. Try to go ahead and wean at an earlier age, by age 1. And then just have water in a cup in between meals. Some motivational interviewing for the parents. You want to make sure that, you're giving them affirmations, you're doing a great job. Roll with the resistance. Just say, okay, maybe you're not ready to hear this now, but we'll talk about it again next time. Summarize everything that you have talked about at the end. And then the open-ended questions, just so that leaves it open for them to then ask. They don't feel like, oh, well, maybe I should already know this. So the actual fluoride varnish application, like we talked about earlier, any PPE that you're going to wear, gauze squares, the gauze is not honestly required. It can be helpful to kind of help move some of the teeth out of not the teeth, you're not going to move the teeth, excuse me, move the cheeks out of the way. It also can be helpful if you have a child that just ate a lot of Cheetos or a lot of goldfish in your waiting room before they come back there, because then you can kind of take that and wipe away some of that, because you obviously don't want to put the fluoride on top of it. If you're putting it on top of goldfish, then it's not getting the tooth. And then finger splints, some offices like to use that just to help prevent getting bit. And then it says consideration or individual pre-filled bags. So if you had, like little baggies that already have these supplies in them, then that just makes it easier. You can say, hey, we have this all right here. I don't have to worry about going to this room to get one thing and the other room to get something else. And it just makes it more efficient. So the application steps, like I said, you're placing that child in a knee-to-knee position or on the exam table. However you can get them, they don't even have to be laying back. If they'll just sit there and open your mouth for them, that's perfectly fine as well. I'll be honest, this picture I don't love, because varnish, if you've ever used it, is very sticky. And so to pour it onto your glove, to me, just seems like an extra step to make more of a mess. So you can just leave it. They all come in a little plastic wrapping, kind of like how it shows here, and then the end of this picture where they're pouring it out is like a little well, so you can just dip your brush in there. If you can dry the teeth off, that's great. You don't have to. The newer fluoride that they have out in the last 5 years or so, it doesn't have to be, you don't have to wait. It's not like when we were little and we got fluoride, you don't have to wait 30 minutes to eat or drink anything after. So if you can't dry their teeth off, they're really not cooperative. Anytime that you're putting the fluoride in their mouth, on their teeth, is going to be better than nothing at all. This is just showing a picture how they're drying the teeth off a little bit with the gauze. And then it says, if you're concerned about being bitten, insert a plastic finger splint, or if they're kind of screaming at you, then that leaves their mouth open to go ahead and paint it. You don't even have to stick your fingers in there. You can just kind of paint the teeth that you can. This video shows that the fluoride varnish is yellow. Also not a great picture. I apologize for some of these older pictures, but most fluoride varnish now is tooth colored. So it may look a little like chunky when you put it on their teeth, but it's not going to be yellow. It's going to be tooth colored. Also, I like to mention, because this is not always the reality, is that someone's going to sit there and just let you put it on their teeth. So if there's only a couple teeth that you can hit, they're really fighting you, I always recommend the front teeth first, and then like the biting surfaces of the back teeth. Now, ideally, we want you to get all the surfaces of the teeth, but if you can only get a couple, those are the ones I would try for the best. So like like I said, the biting surfaces of the back teeth, and then the front teeth, because those are where children this age are most susceptible to get cavities. We'll see if this video will play. This just shows an example of painting the fluoride on the child's teeth. I don't know that you can hear it.
No, there's no sound.
Okay. So you can see that was an older video. You could probably tell without the fluoride being yellow that that was an older video. But they can go ahead and eat and drink. We do say maybe don't eat anything real sticky right after. So like Laffy Taffy or any type of candy that would be real sticky, that can kind of pull it off, that it'll get stuck on your teeth. If they're getting it done like lunchtime or later, we definitely tell you not to brush till the next day. If it's like 8 o'clock in the morning, sometimes I'll just say don't brush until you go to bed tonight, because the longer that fluoride stays on, the longer it has to work. The only contraindications would be if they have ulcerative gingivitis, which would be really rare in a young child, or depending on the type of fluoride that you get, there has been instances where if a child is allergic to tree sap, they had a reaction, an allergic reaction to it. I know what we use at work, we did switch to the kind that doesn't have that ingredient in it any longer, but that's just something that you want to be aware of for whatever product it is that your office is using. So coding and billing, only trained providers can render the IMB services. There is an online toolkit, then I could send the link for that as well. If you ever have any new providers come to your office and you want them to be trained, they can train themselves. They just don't get the hour CE credit for it. So the Medicaid reimbursement process, like I said earlier, it has to include the evaluation, the education, and the application of the fluoride. So 1206 has to be filed in conjunction with 0145, and 1206 has to come first on the billing line. Like I said earlier, it can be done in a well child, sick visit, any type of office visit that they're coming. It just has to be 60 days between those visits. And then again, reimburse up to 6 visits through age 3.5. Also, always like to mention that Medicaid and dental Medicaid do not overlap with one another. So if you had a child that came to your office and you placed a fluoride varnish treatment on their teeth and they said, oh, well, I just went to the dentist 2 months ago, or I have an appointment, at the end of the month at the dentist office, and they're going to place fluoride again, it's not going to hurt the child to have, multiple varnish applications, but it's also, I just like to say that because, sometimes people get worried that insurance isn't going to pay for it, but as long as it's like a medical office and a dental office, then it's still going to reimburse it. Medicaid managed care and IMB is carved out of the predetermined prepaid health plan capitation rates, and you submit claims to the beneficiary's assigned health plan. And then the total reimbursement is $54.79. Like I said earlier, a lot of private insurance companies may reimburse for it, but you would have to call those insurance companies individually. There's no modifiers needed, and then the same Medicaid billing procedures for private practice, health departments, FQHCs, and then community health centers. It's all the same. So for a risk assessment, this is a good little tool that you can use. It's not something that you have to use. But it just kind of helps you decide if you need to refer or not. So it's just simple 2-step process. Ask the parents a few questions. You use a visual oral evaluation, and then only a small percentage of these children will probably actually require a referral. So there's 3 sections. The first section, ask yes or no questions. Depending on what they answer to those, then you're going to refer to the dentist. So if 3 or more of the shaded boxes are checked, then you're going to refer. And I'll have a link to this as well that I'll send out if you want to use it. Again, you don't have to. It's just a good tool, a good resource for you if you'd like to. So that the section A is what you ask the parent and what their answer is. Section B is for the medical provider. So if you check yes to any of those questions, you're going to go ahead and refer the child to a dentist. And then you also want to make sure you're educating them, discussing good oral health behaviors. And then the last section is would be great if it was you. So you're going to send that form with them to the dentist, and then the dentist is going to fill out what they did or what they saw, and then the patient can send that back to you. And so it just helps close the loop of communication between the dentist and the medical provider. Documentation, make sure, when you're doing your oral evaluation, that you're documenting anything that you may find. Even if you're not sure about it, it's always good to document that you're given education, and then the actual application. And then obviously you also want to document if you refer to a dentist so you can follow up with them. So the outcomes of the IMB program: children receiving 4 or more IMB visits before age 3 showed a 17.7% reduction in tooth decay. IMB reduces the need for dental treatment services, as well as increases dental access when medical providers refer children for care. Like I said, they're seeing you a lot of times before they're ever going to come see us at the dentist office, so they're going to trust you more as well. So if they're seeing you on a regular basis, they're trusting you. When their child has a cold, they're also going to trust you probably more likely than they are going to trust us if you tell them that they need to see the dentist. The Into the Mouths of Babes program has contributed to a statewide decline in decay rate since 2004. And then the goal is just to help reduce that gap in tooth decay between children from low and really all income families at the community level. So helpful hints to get the program up and running, or to maybe improve it if you're already doing it. Go ahead and identify children on your schedule ahead of time. So like, hey, I'm seeing Johnny after Sally, and Johnny needs a fluoride treatment. If you have somebody in the office that can coordinate that system, that's great. If everyone in the office is trained, that's also great, because then you don't have to wait for Susan to come do it because she's with someone else. Keep the supplies, like I said earlier, in a handy little kit. And it says use the knee to knee position, but really it can be any position that the child is comfortable in. And I may have skipped this earlier, but like I said, it doesn't have to be an additional step. When you're in there doing the exam and the provider is, looking at in their mouth and looking at their tonsils, and they can go ahead and kind of do the exam then as well. It doesn't have to be an extra step after that's all finished. The benefits is preventative care. It helps find a true medical home for families that are busy. It's good for your business, and it's also considered superior patient care because you're helping make sure their entire body is healthy. So let's see. I'm not gonna escape, but I'm gonna try to see if I can copy this. I don't know if it's gonna let me. My computer's being funny.
I think I can send it out in the email. I think I did that
Okay.
last time. Just
Okay, I'll
yeah,
just do that because I have what I'm actually going to send you has this QR code on it as well. So I
perfect.
can send you that and the link at the same time.
Thank you, ma'am. I appreciate it. I know we're over time just by a minute, but I want to make sure everyone had their questions answered. I think William did get his answered. The minimal interval between treatments
It just
recommended.
said it has to be at least 60 days.
Okay, just want to
Um,
make sure.
is the minimal for insurance to pay for it. So,
Awesome,
and
perfect.
if you think of any questions, feel free to send my information out as well, Crystal, when you send it, and they
We'll
can
do
feel
that.
free to email me or call me. But thank y'all so much.
Thank you so much, Heather. We hope you guys do come back next week. We're going to review our measures of the month, the diabetes suite, and you can see these topics also in these out the follow-up email as well. Again, thank y'all for joining us today, and thank you, Heather. We'll see you next month on the 27th to go over perinatal oral health therapy. So
Okay.
thank you very much.
Thank
All right,
you.
guys. Y'all have a good Wednesday.